welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Physical health and wellness are more important than ever, despite the fact that health and wellness were already important previous to the health crisis. The spread of COVID has pushed them to the top of the priority list. The pandemic not only brought attention to the country's urgent need for improved public health infrastructure, but also demonstrated how the incidence of lifestyle diseases is becoming a significant source of concern. Declining physical activity, sleep disruptions, inadequate nutrition, and increased substance use all have repercussions on the emotional and physical well-being, especially in a young population. Awareness about such lifestyle disorders is important in a young population, and once you're aware of risk factors, then you can take the right decisions. We have our panel of experts to help guide us on that. We're joined today by Dr. Shivendra Verma, Consultant Endocrinology, MMI, Narayan Super Speciality Hospital, Raipur, and Dr. Dibya Ranjan Behera, MBBS, MD, DM Interventional Cardiologist, IMS, and Some Hospital, Bhubaneswar. Thank you so much, doctors, for joining us today on the program to answer all our questions. And Dr. Verma, I'd like to start with you. Type 2 diabetes is usually more commonly seen in middle-aged or older adults. Can you get type 2 diabetes in your 20s? And if you can, what are the risk factors or warning signs that young people need to look out for?
Yeah, that's a very good question. Type 2 diabetes previously have been thought that it affects middle-aged and elderly people, but of late, we are rapidly seeing people in their teens and 20s also. So even last week, I have seen one girl, 13-year-old, and a boy, 17-year-old, having type 2 diabetes. So it's not that only older people can get diabetes. Now, there are many factors which are responsible for this development of young onset diabetes. So I will start with genetics, which is very predominant factor. So many people who have multiple family members having diabetes, they also tend to develop diabetes and quite an early age as well. Other factor is adiposity. That means the distribution of fat, which in Asians compared to Western cohort is more of a visceral fat. That is, more fat is there in our visceral organs compared to the skin fat, which is also a factor responsible for higher insulin resistance. So that is also one factor. Apart from that, if you look back into the history of the children, if they have a low birth weight or a high birth weight, say more than 3.5 to 4 kgs or less than 1.5 to 2 kgs, these children in their future, they are more likely to develop diabetes. So this is also one risk factor to watch out for. Plus the increasing incidence of childhood obesity. This is also one common factor, rapidly increasing childhood obesity. And these all tend to develop diabetes at an early age. Now, we can discuss about lifestyle factors that we see a lot of children now doing online classes. So the screen time has increased, the screen time for the online classes. Plus, they also prefer playing online games. So the screen time is so much increased that this is also leading to physical inactivity. Plus, the food style have changed. Children and young people prefer more of a junk food. The increasing stress in younger people is also responsible for development of diabetes. The use of substance abuse, smoking is also one factor. So these are all the factors which I can say are the risk factors for the development of diabetes, especially young onset diabetes in our population.
All right. Now, Dr. Ranjan, non-communicable diseases are a result of a combination of factors, including genetics, physiology, environment, and behavior. So which are the common non-communicable diseases seen in youngsters?
Yeah, in India, today, non-communicable diseases are on the rise. Previously, it was communicable diseases, but now non-communicable diseases. As Dr. Shivendra already said, that diabetes, blood pressure, obesity, these are rapidly increasing, and dyslipidemia, particularly if your cholesterol level is very high or not. So, this present pandemic of COVID has boosted it, because many people are making a sedentary lifestyle. They are not going out. So these are the non-communicable diseases that are on the rise. And communicable diseases are previously on the rise, but now this non-communicable disease, that means that is not communicated from one person to other. And mostly they are diabetes, blood pressure, dyslipidemia, obesity, and the most common is coronary artery disease. And this coronary artery disease is the number one cause of death, not across world, but in India also. So we have to really check for it.
All right, Dr. Verma, now as the younger population is getting detected with diabetes, early screening for diabetes is clearly a necessity. So at what age should people start screening for diabetes, and what other tests do you suggest?
Yeah, that's a very good question. So, since diabetes in most of the people is asymptomatic, that is, without any symptoms, people can live with diabetes for so many years. And we have seen patients coming for total knee replacement or even with acute coronary syndrome. And once you check the blood glucose levels, you will be surprised to know that the blood glucose levels may be as high as more than 300 or more than 400 as well. So it is necessary for a regular screening of all the individuals. As far as guidelines are concerned, at the age of 45 is the age when you should start your annual screening for diabetes. However, some individuals who may have additional risk factors, like they are overweight or obese, you can see some people may have skin tags or blackish discoloration around the neck, that is known as acanthosis nigricans, or if they have a very strong family history of diabetes, it is preferable to start screening themselves at as early as at the age of 30 years. However, again, as we are already seeing a lot number of people with diabetes in their teens as well, so those who have florid symptoms of even rapid weight gain, severe signs of insulin resistance, associated dyslipidemia or hypertension, they should also be screened as soon as possible. This is not the end of the test. Apart from the routine fasting blood glucose levels, postprandial or oral glucose tolerance test, a glycated hemoglobin, these are the basic tests for the diagnosis of diabetes. Apart from that, we need to check for the cholesterol levels, or you can see the low density lipoprotein and high density lipoproteins. Blood pressure monitoring is also necessary in all individuals, along with a basic ECG if there is a family history of coronary artery disease.
All right, Dr. Ranjan, now heart attack, cardiac arrest and other cardiovascular diseases have remained a major health concern around the world. But more recently, there's been a rise in the number of cardiovascular problems among the younger population. So why have heart attacks become so prevalent in the younger people?
Yeah, now if you see that India is full of younger people, the younger mass is the major mass in India. And they are all started with a very sedentary lifestyle. So the most common thing is sedentary lifestyle. And as Dr. Shivendra was telling, this is diabetes is coming to a very young age, and they are all going for early substance abuse. They are quite much stressed. So these are the factors. And family history, of course, family history is very important. But the most common thing, what I'll say, is smoking, diabetes, this high cholesterol level. These are the most important things that the younger generation should check. And there is a study already done in Sri Chitra, Kerala, and so many other studies also there in very national institutes. They are seeing that almost 25% of the CAD population is attributable by the young CAD population, which is very much concerned as far as India is concerned. So the younger generation are the generation which actually the economy depends upon that, the whole family depends upon them. So if it is rising in this young population, it is very much concern for our state, for our country also.
No, absolutely. And it's very concerning to have this rise, in heart disease cases or heart attacks among the youth. Dr. Verma, let's talk about women now. And PCOS, polycystic ovary syndrome, is a hormonal disorder that affects women of all ages. Can PCOS affect teenagers? And what are common problems faced by teens who do have PCOS?
Yeah, PCOS actually is a very common endocrine disorders. In fact, as common as maybe hypothyroidism. It affects around 10 to 20% of the women. It is actually a constellation of symptoms like anovulation. That means women may have menstrual irregularities, or if incidentally done, ultrasound may show polycystic ovaries, or you may see a cystic pattern of multiple cysts in a specific type of morphology on the ultrasound. Plus, they may have features of hyperandrogenism, that is the signs of increased male sex hormones, which may be characterized by presence of acne, abnormal body hairs, or even the loss of hairs on the head, that is alopecia. Now, in teens, if you see the once the menarche is started, it is common to have irregular menses for at least 1 or 2 years, and the regularization occurs by around 17 to 18 years of age. But there are certain red flags, like if the girl is having a period, missing periods of more than 3 months, if a girl or a woman is not having is having less than 8 periods in 1 year of time, or if the intermenstrual period is less than 24 days or more than 35 days continuously, these are the red flags to show that they may be having PCOS. Apart from that, the development of abnormal body hairs, especially the upper lips, chin, chest, back, and the upper arms and inner thighs, these are also signs that they may be associated with PCOS, which is a very common symptom in PCOS. Other symptoms which are rarer is development of bothersome acne, that is pimples, which are more of a pustular, that is whitish or yellowish acne, development of alopecia, loss of hairs over the head. These are the signs which can be present even in teens, and then we have to watch out for PCOS, and we have to also look for other endocrine disorders apart from PCOS that may be responsible for these symptoms, like presence of hyperprolactinemia, that is increased prolactin hormones that may be associated with the milky discharge from the breast. Presence of overt hypothyroidism, associated over hypothyroidism could be one possibility, and the other rare endocrine disorders like Cushing's syndrome, congenital adrenal hyperplasia, that may be responsible for presentation as PCOS.
All right, now Dr. Ranjan, if we talk about, the youth and early onset of substance use is associated with higher risks of developing many health complications. So how does it affect cardiovascular health?
Yeah, you can see that many things that can complicate cardiovascular health. So if you talk about this substance abuse, that particularly the cigarette smoking, which is the most common, and tobacco, they not only cause oral cancer and all, they can affect the cardiovascular health in a significant manner. You can see that they can lead to immediate coronary vasospasm, that can lead to a sudden heart attack in very young people because of coronary vessel rupture. And also in a long term, they can use atherosclerotic plaque. They can slow down your cardiac muscle contractility, the power of contractility. They can lead to plaque development, that is called blockages in any, apart from heart, in your brain, in your kidneys, in other blood vessels, in your both legs. So whole of the cardiovascular system is very badly affected by this smoking and other substance abuse. And if you talk about other things like cocaine and all, they can cause immediate cardiac arrest also. So with sedentary lifestyle, with transition in economy from a low economic to a middle income economy, and very much young people, corona pandemic, so all this leads to higher incidence of substance abuse, particularly in youngsters, and that is very much dangerous for the society. So we have to take adequate steps to counsel them, and through various programs, various awareness programs, through various government stricter guidelines, we can check them. Though we write that warning sign that it is injurious to your health, but actually 90% of the population, they don't know how much injurious it is and what are the effects. They can affect anybody. They can do cancer, they can do coronary artery disease, and nowadays, and they can also, if you get corona, if you're a smoker, then that also affect your lungs very badly. So in every aspect you are at loss, and you are at extreme dangerous situation. So please don't smoke and don't do any substance abuse.
All right, that's something that youngsters and parents need to watch out for. Doctors will slip into a short break and return with more questions for you. Stay with us. Welcome back. We're talking about health and watching out for the signs, especially for the young. Let's go across to our doctors. Dr. Verma, now there are a number of subtle signs of thyroid problems in young people. And even though the symptoms might seem minor, it's important to recognize them. So if you could tell us, what are some of the common symptoms of thyroid-related issues?
Yeah, that's a very good question. So again, like other endocrine disorders, even thyroid disorders like hypothyroidism may be asymptomatic. That is, they may be diagnosed once the patient undergoes the thyroid function test checking. If you go through the Western data literature, there are our population may have a different signs. While Western population may have common symptoms like dry skin, coarse skin, you may see puffiness around eyes, some kind of swelling around the eyes, or decreased sweating. Constipation is a very common symptom, which is also seen in Indian patients. While if you go through the Indian data, one good study was there which showed that these telltale signs may be absent in our Indian cohort. And fatigue, that is the weakness and is the most common symptom in our Indian scenario. And if you go in the children, where the hypothyroidism can also happen, poor concentration, that is not able to concentrate on the studies, is common symptom. Apart from this, the short stature, I have seen very few children in which the hypothyroidism remained diagnosed for 4 or 5 years. In those precious years where their growth was very important, they had a very minimal height once the diagnosis was made. And one girl I've seen last week who was just 106 centimeters and was 13 years. So this is important in our Indian context, that the hypothyroidism is widely prevalent. The symptoms are not very florid in most of our patients. So a high index of suspicion is required, both from the individual side and both from all the physicians. And we have to be more, you can say, very fast in ordering thyroid function test and once even a slightest of suspicion is there.
Right. Now, Dr. Ranjan, what are the warning signs that young people who are at risk of heart disease that they need to watch out for? Because as we discussed earlier, we're seeing more and more heart disease in the younger people. So what do they need to watch out for?
Yeah, they should know that there are some risk factors which can check for heart disease, like obesity, increased obesity, this is increased body weight, and there is their cholesterol level, to check their diabetes status, because many people, they get diabetes very early in their teens, and the family history, their strong family history, you need to check it earlier. Then there are subtle signs that, particularly the abdominal obesity, the abdominal girth, there are some signs like we called xanthelasma in the eyes, some tags, skin tags in the eyes that shows that you are having increased cholesterol levels, you are having wrinkles over your neck, you are having some strips over your abdomen. So that all signs of insulin resistance that can say that you are having low. In some genetic cases, you can get small tuber-like things, small masses around your legs, your buttocks. That also signs of hypercholesterolemia. So, and the blood pressure. Actually, if you consider now, almost 1/3 to 1/4 of population is having blood pressure. So regularly check up your blood pressure, your weight, your things like your these try marks over your neck. So all these things, particularly I'll stress upon obesity and the early screening of your blood parameters like blood sugar, cholesterol, your LDL, your HDL level, and if you are having familial, your triglyceride level. So all these things, and particularly some other tests like lipoprotein and ECG and echo. You can also do if you are having more stress, if you are going for if you are climbing upstairs more than 2 steps, if you are feeling breathless, if you are feeling chest pain, if you are having reeling of your hair, these are, you are having sweating. So these are the definite signs of a weak heart, or you are having some heart problem. So immediately go to your doctor and take signs. Take your examination done, so that you can know that you are having early signs of some heart problem.
All right, Dr. Verma, now when younger people are detected with type 2 diabetes, do they have more severe symptoms or do they develop complications sooner?
That's again a very good question. So, as Dr. Ranjan has already pointed out, that Indians have young onset coronary artery disease as well, and we also have a young onset diabetes that is becoming highly prevalent right now. So, the symptoms of young onset diabetes are no different than the older or elder counterparts. Most of the times it remains asymptomatic, or the symptoms may range from florid osmotic symptoms like weight loss, polyuria, polydipsia, even in young onset florid type 2 diabetes. But the problem is, once the diabetes is diagnosed as at a younger age, they have to live with their diabetes quite a longer period of time compared to their older counterparts. For example, if I have been diagnosed as diabetic at the age of 25 years, another 50 or 60 years I have to live with this diabetes. So definitely the chances of developing complications like coronary artery disease, as well as stroke, peripheral arterial diseases in which patients may go on to develop gangrene in their toes and feet, is quite common. Along with that, the microvascular complications like diabetic retinopathy, development of chronic kidney disease, presence of neuropathy in which patient complaints of paresthesia, tingling, and numbness in their feet is also very common, because again they have to live longer with their diabetes. One particular concerning fact which we have seen, and Dr. Ranjan would be agree with that, that the patients, young diabetic patients presenting with coronary artery disease also have a very high atherosclerotic burden. And instead of single coronary arteries, they may have double or triple vessel disease, which is also very concerning even in our younger patients. So right now, I would suggest a primordial prevention is the need of the hour. Every school must encourage at least 60 minutes of daily physical activity. It should be around moderate to severe intensity exercises. Mass level campaign should be encouraged for improvement of our dietary practices right at the level of the home and schools. So this is again, since it is a disturbing fact, we should act fast.
All right, and as always, a prevention better than cure. Thank you so much, doctors, for joining us on the program today and talking about the risk that, health risks that young people face and some of the warning signs to watch out for. Thank you all at home for watching. Goodbye.